A diagnosis of knee osteoarthritis can really take away your sense of control over your own physical health and your own body. And when we start to have pain in our joints, it can also make us feel tempted not to move as much and perhaps reduce some of our activities of daily living or recreational activities. And when we do that, it really starts to reduce our quality of life. So the important part about starting and engaging in an exercise program is that by increasing the strength around the joint, you can actually get better control of those symptoms and start to get back to those things that you love. The focus of this program is to teach you a neuromuscular exercise program in order to maximize the health and efficiency of movement around your knee. A neuromuscular exercise program simply means strengthening the muscles in a way where you're also consciously thinking about your body position and alignment. This is what makes these exercises different from just standard or basic strengthening work. Before we get into the exercises, I want to take a couple minutes to review the basics of knee osteoarthritis. It's important to understand what's happening in your knee in order to understand how our activities and our exercises are going to positively impact it. So if we look at the knee, in osteoarthritis, it's a degradation of the articular cartilage that lines the bone. So at the bottom of the femur or thigh bone, there's a layer of cartilage underneath here, and at the top of the shin bone or the tibia, there's a layer of cartilage there. As we move around and we bend and straighten the knee, and we load it with, say, a jumping or a running type activity, the articular cartilage that's there that should be protecting the bottoms of the bones starts to be not quite as effective in doing that. And that decreased efficiency of that cartilage contributes to more rubbing of those joints together, and that creates the pain that we often associate with osteoarthritis. Because knee osteoarthritis is very common and its symptoms can really impact people's ability to participate in the activities that they love, there's been a lot of great research to tell us what the best approach to management is. And basically, there's a pyramid approach that we know is most helpful. So everyone with osteoarthritis can benefit from exercise, education, and for people for whom it's appropriate, weight management is also important. However, exercise, education, and weight management sometimes isn't enough, and so because of that, sometimes people move to that second tier of the pyramid. In that second tier, we think about things like braces, orthotics, sometimes passive treatments by other healthcare providers, and it's also where we would consider medications, either prescribed or over the counter. Lots of times using the first and second tier can be enough for people to manage their symptoms. But of course, sometimes then people have to progress into the third tier, which would include surgical intervention, usually total joint replacement. To participate in this program, it will be best if you're wearing loose-fitting clothing comfortable for exercise, ideally a pair of sneakers or comfortable footwear. You'll definitely need a stable chair, and if you have light weights or exercise bands, you may choose to have those close by, but they're not necessary for this series. If you're using a spring-loaded brace, feel free to adjust the tension to whatever feels best to you. Place a chair against the wall. You may choose a chair with or without arms. Sit in the middle of the seat with your feet on the floor, hip-width apart. Ensure your knees are also hip-width apart and in line with your feet. As you stand up, feel your thigh and buttock muscles engage to bring you to a fully standing position. If it is difficult to do this without the use of your hands, use your hands gently on the arms of the chair to provide whatever boost you need. Slowly sit back down, using the arms if necessary for safety. The sit-to-stand exercise is probably my favorite strengthening exercise. Not only is it functional, so it's something that we do every day, but also it's a perfect place for us to really concentrate on the hip, knee, foot alignment that is ideal from a neuromuscular control perspective. Making sure that the hips, knees, and feet stay lined up with each other as we do this exercise helps to make sure that we minimize the stress to the joint and maximize the use of the muscle. Make sure as you do this that those knees stay apart the whole way through. When considering starting a new exercise program, it's really important to take a few minutes to think about the goals and the plan that you're going to use in order to ensure your own success. Using a log can be a helpful way to track how often you're exercising, and also a good tool to start to identify what your goals are going to be in terms of number of days per week that you're going to participate in your program, and maybe how many minutes per session you have available. A 2-hour program every day is great, but it's only great if you do 2 hours of work every day. So setting realistic goals is really important. If you don't have a log already, we've prepared an activity tracking tool for you to use. It's also helpful to think about, what does success look like to you? What are your goals in terms of real outcomes for yourself? So are you hoping to have less pain? Are you hoping to be able to walk a little further? Are you hoping to sleep a little bit better at night? So take a minute to think about what a successful outcome will be for you after several weeks of participation in this program.